Shape of the City. I'm Clover Frederick, and I'll be your host. Colorectal cancer is the second deadliest cancer in the United States for men and women combined, with about 1 in 20 people developing it at some point in their life. So what do we need to know in order to detect it early or even prevent it altogether? Let's find out. With me today are David Humm with the Lincoln-Lancaster County Health Department and Tamara Robinson with American Cancer Society. Thank you both for joining me today. Right. Let's start with you, Tamara. Now, first of all, what exactly is colorectal cancer?
So colorectal cancer is cancer of the colon and rectum. Most people generally like to refer to, or have it referred to more as colon cancer, and how it develops is through precancerous polyps. And those generally take about 10 years to develop, so that's why routine screening is so important for colon cancer.
Okay. Now, what are some of the key factors in developing colon cancer?
Really, for colon cancer, family history is one thing. Nutrition and exercise are kind of some behavioral risk factors that can play a part, but for the most part, there really is no thing. Anyone can get colon cancer, so that's why routine screening is so important.
Okay, now let's talk about that screening for colon cancer.
So for colon cancer, the screening generally there are a couple different types. The two most common are the stool blood test that a lot of people have heard. It's called an FOBT, so it's fecal occult blood test. That is something that people can get and take home. They can actually get them from the Lancaster County Crusade during the month of March for free. And then also the other one that's most common is the colonoscopy, and that is one that is done once every 10 years, and that is done through their doctor. You need to go to a hospital or through a gastroenterologist and have it done as an outpatient procedure.
Okay. So if you're under the age of 50, is there any reason why you should get screened?
Yes. In talking to your doctor, if you have any kind of family history of colon cancer, that may be one thing. And the other things to kind of watch for, if people are having any kind of blood in their stool, if they're having rectal bleeding, any kind of change in their bowel habits, if there's unexplained weight loss, fatigue, anemia, those kind of things they need to be talking to their physician about.
What are some of the myths and challenges that are keeping people from getting screened?
Well, a lot of those would be, probably one thing is around payment, that it's not covered. With the Affordable Care Act, there is insurance. This is a preventative measure, so that is covered under insurance. The only thing would be that they need to be mindful of is there is a loophole right now with Medicare that if the doctor would go in and they do find some polyps and remove them, that it could be considered diagnostic, and then there may be a charge, but that is something that actually federally is being worked on to get changed. But for other private insurance and Medicaid, that's not an issue. I think the other thing would be for people that a lot of people just don't think that they're at risk for it. And the thing is, it is common, and there are no symptoms that they're thinking, well, I don't have any of those symptoms. Sometimes there aren't any. That's why when you hit the age 50, why it's so important to get the routine screening done. I think the other one I hear the most about is just how horrible having the screening done is. And actually, if you talk to people, it's really, if you get colonoscopy done, it's once every 10 years, and it's not as bad as what people think. And then you can be worry-free for 10 years after that.
Okay. Now, if diagnosed with colon cancer, what are some of the treatment options available?
The treatment options are going to depend kind of your stage of cancer, just like any other cancer that's out there. So some options could be doing a resection of the piece of the colon that's has the polyps in it, or it could be radiation. They could get chemotherapy, but all that's going to depend on kind of the treatment plan that they come up with their oncologist.
Okay, very good. Well, now let's talk to David a little bit about what's going on locally. What do the numbers look like in Lancaster County as far as colon cancer deaths?
Sure. Well, unfortunately, Nebraska and Lancaster County is no different than kind of the rest of the country. That it's also the second leading cancer. Colon cancer is the second leading cause of cancer deaths in Lancaster County and in Nebraska. And you know, it's estimated about every year 850 people in Nebraska will be diagnosed with colon cancer every year, and about 340 people will die every year from colon cancer in Nebraska.
What sort of support or education is available to people in Lancaster County regarding colon cancer?
Sure. Well, fortunately, Lincoln, like many health issues, we do have a lot of resources in our community. We do have a Crusade Against Cancer coalition for our county anyway, and we have a lot of our partners at the hospitals, and I won't name everybody, I'll probably forget somebody, but we meet about 7-8 months a year and kind of plan around March and April. March is Colon Cancer Awareness Month, so we do plan a lot of awareness and education around those months. But it happens all year round. But it is kind of always nice. I know people probably get tired of Awareness Month this, Awareness Month that, but it is kind of nice to really draw attention to something in a small amount of time anyway. And so our group, again, we plan things around this time, and not only just awareness, but we do provide screening kits. I know Tamara mentioned the FOBT kits. We do provide the screening kits for free in participating pharmacies for the month of March and April, where anybody that's 50 or over can go to a pharmacy and pick a kit up for free. And then we'll help with follow-up. Of course, they have to put their information and then we'll get back to them, and the lab will let them know what their test results are, and we'll do follow-up there. So that's a big part of what we do as far as giving people the opportunity to get screened in the month of March. But again, besides that, a lot of our partners, gastroenterologists in the hospitals and Lancaster County Medical Society, helps throughout the year, encouraging physicians and things to remind people that are 50 and over to get screened.
Okay. Now, where can people go to just get some general information about colon cancer?
Sure. Well, the American Cancer Society is a great resource to get general information, not only colon cancer, but all cancers. And again, we do have a local website that's on the health department website, but if you go to lincoln.ne.gov, keyword colon cancer, we do have a page that has basic information, links, and also you can download information, even a coupon that you can go to the pharmacy. Now, you don't need the coupon, but it's kind of nice. It has a list of what participating pharmacies there are. There's about 36 pharmacies in Lancaster County that are participating with us, and so you can go there and download that coupon, and it'll list all the places you can go get a kit, which is very helpful.
Now, any final messages for our viewers?
Well, I'd just like to say, the purpose is to get screened, no matter what the screening is. If you're 50 and over, there's a lot of opportunities here locally, and we want to encourage you to get screened. Again, I mentioned the free kits, but also the colonoscopy. Oftentimes, people think that's a bad word, or scary, or it is it's an invasive procedure, so people are kind of afraid. But you have to take that step. There's no excuse not to get screened. People talk about the prep and things. It's basically they just have to drink a lot of fluid to kind of clean you out for the procedure. And really, that's the worst part. The actual procedure is very simple, and so we just really want people to get screened.
And I would just say, if you know people in your life, 50 older, encourage them to, and they haven't been screened, ask them, have they been screened, and encourage them, because getting that screening really could save their life.
Okay, very good. Well, thank you both for joining me and reminding us how important it is to get screened. Thanks a lot.
Thank you.
When we return, we'll hear about some books that are aimed at energizing children.
That's personal. I don't know what to say. Oh my God. Okay, I can't do this.
I can't think of anything clean.
My rump roast. My caboose. The booty.
Nalguitas. Sweet cheeks.
Big sexy.
Moneymaker. My booty.
Bum.
The donkadonk.
I think you just call it my butt.
No matter what you call it,
Have it checked.
Have it checked.
Have it checked. Love your butt. For more information on Colon Cancer Awareness Month, visit loveyourbutt.org today.
As parents, we continually get flooded with nutrition and exercise suggestions for our kids on television and online. A local nonprofit called Teach a Kid to Fish had a clever idea to create healthy messages not only about kids, but also from the kids themselves. Joining me today is Rick Helweg, Executive Director of Teach a Kid to Fish and author of the Energy Children's Book Series. Hi Rick, thanks for joining me.
Thanks for having me.
So tell us a little more about Teach a Kid to Fish, what the programs are, and
Teach a Kid to Fish, our mission is to prevent and reduce childhood obesity by empowering children and families to eat healthy and be active. And we work on a number of different programs that address certain segments of the population. We do wide messaging programs like the book series that we're doing. We do a lot of programming in child care centers, training child care center operators on how to make their settings healthier. We work all the way up to doing individual obesity intervention at our Heroes Clinic that we are working on in partnership with Children's Hospital of Omaha.
Now, Rick, describe for me the energy books. What's some of the messaging?
The messaging is based on our energy acronym, ENERGY. And the first E is eat 5 or more fruits or vegetables every day. And then it continues, no more than 2 hours of screen time. Each day be active for an hour or more. Rethink your drink, get plenty of sleep. And finally, the Y is the positive message of you can do it.
All right, great. Now, how did the whole thing get started with the books?
Well, it actually started with our Safe Routes to School program a number of years ago. We received funding from the Safe Routes to School funders, and we were working in schools developing messaging for students and parents about promoting walking to school and biking to school and how to be safe doing that. And that kind of ran its course, and we were really excited about continuing to work in the schools, working with students to help develop messaging for their peers, because we found that that's very effective than me going into the classroom and I'm kind of a finger wagger telling them they should eat their fruits and vegetables. And I had written the first book in the series a number of years ago for the Chicago Tribune about walking to school. And I just thought I would continue that with the same characters, Mookie and his sister Sid and their dog Joe. And we had talked to several professional illustrators and weren't really very happy with what we were seeing. And Bob Reeker, who's the art specialist at Eastridge Elementary School, where my kids go to school, they went to school, is very supportive of the project, as was Deb Dabbert, who is the principal at Eastridge. And he suggested that we might want to get kids to create the art. And what a great idea, and it's been fabulous and fun, and we continue to work on it.
Well, give me a little taste of what's in the first book.
Well, the basic plot line of Mookie's Mission E for Energy is that Mookie learned from his grandfather, by working in his grandfather's garden, how good and important it is to eat fruits and vegetables. But his sister, who is 6 years old, Mookie's 9, his sister is 6, and his sister has not yet learned this. In fact, she lives on sweets. She loves candy. She loves root beer. She loves anything with lots of sugar in it. And so Mookie has taken it upon himself to teach her the lessons of good nutrition. But he knows that he just can't say to her, you have to eat an apple. He's got to kind of be sneaky about it. And so he adopts his alias as a secret agent, and he makes it his super secret mission to try to get her to eat healthy foods. And he enlists Joe, their dog, as his sidekick. And it's written in verse, as all the books are. and it is it's aimed at about the 3rd grade reading level. And so, of course, that, you know, the younger kindergartners, 1st and 2nd graders who maybe are a little bit more advanced readers will read it. And it will also be enjoyed by kids who are older elementary school.
Sounds like fun.
It is. You know, and when we started doing the illustrations, and all I had was text, I had all the kids that I was working with, who were mostly 3rd, 4th, and 5th graders, take it home and treat it to their younger siblings so I could get a little feedback on them. And the feedback from the younger readers has also been very important to me. When I go in and start working with a group of kids, I tell them, if there's anything that doesn't seem right to you, if there's anything that you needs to be changed, let me know. And when we were working on this, we were about 2 days from going to print, and I got 3 pages of notes from a 4th grader. At the top, it was very clearly written, things you need to change. And you know, about 90% of them were right on.
That's great.
Yeah.
Very good. And we expect that to be the same thing with this sort of messaging.
Well, right, yeah, whether it's eating your fruits and vegetables or, you know, not spending too much time on the screen, I know, which is something that I know we struggle with in our house. I think that, you know, the families share that message.
Great. Now, what have you learned by working with kids?
You know, it's, you know, I guess what I learn and am reminded of every time that I work with them is how important it is to keep, you know, the fetters off of your creativity. And because working with kids, they're so creative and there's really nothing that holds them back, maybe except for experience, but you know, it's just a blast. I was working with a group yesterday at Cooser Elementary. They're working on the book about getting plenty of sleep. And we started talking about what life looks like from a fish's point of view. Because one of the characters in the book is a fish, and it's assumed that because fish don't close their eyes, they never sleep. And so all of the kids were chiming in with, how do fish see things, and what would life look like if you were in a fish bowl? And you know, there were a billion ideas. And they start drawing, and the excitement and the enthusiasm of the creative process was just so much fun. And it's a great thing to remember as adults.
Absolutely. So why do you think it's so important to have children involved in creating these messages?
Well, like I said earlier, I think that kids are more likely to listen to their peers. Obviously, you know, as parents, it's great to set examples for your kids. But something we learned, especially working with middle school kids, is that you know, they do pick up a lot from their peers. And when peers are informing their friends about ways to eat and ways to be active and those good healthy life lessons, I think it's important, and kids pick up a lot when they hear it from their peers as well as from their parents.
So how can this message affect a whole family?
Well, we find and have found, you know, we found this very early on when we started doing the Safe Routes to School program, that things that the kids talk about amongst each other and the messages and the lessons that they learn amongst their peers, they take home. If you're a parent and pick your kid up after school and you see all the traffic around the schools, we learned that when we were talking to kids about how their parents drive and the way their parents behaved at drop-off and pickup time, you know, they would shut their eyes and say, you don't want to see the way my mom drives when she drops me off. And she would say that she would talk to her mom and tell her mom how important it is that she park in a safe place, maybe that they consider walking to school. And you know, they trade those safety messages back and forth with each other. So they do take them home, and that's really nice for me to know.
So what's the response been to these books?
It's been great. I think we had 3,000 copies of this book printed. We are so fortunate to have been working in partnership with Nelnet on this project and their publishing subsidiary, Peterson's Publishing. And I think it was in May of last year, we had 3,000 copies of this book, and now we're scrambling to fill orders and find more, and this is ready for its second printing.
Great.
And we're looking at, we've got a couple of other books that are just about ready to go to the printer, and there will be 6 books in the series. Hopefully in the end, about a year from now, we'll have a box set of 6 books, and we're even starting to think a little bit beyond that and where to go from there.
Now, how can our viewers get more information on Teach a Kid to Fish, or perhaps if they'd like to have one of these books at home?
teachakidtofish.org, our website, is the best place to go, and you can learn all about the books and all about the programs and how to get involved.
All right, great. Well, thank you so much for being here. We can't wait to see what Mookie does next.
Thank you. Fun to be here.
Stay tuned. The dietary guidelines for Americans have changed. What you'll need to know is next.
Hi, I'm Alice Henneman, a registered dietitian and extension educator from UNL Extension in Lancaster County. I'm here to tell you a little bit about the new 2015 dietary guidelines. There are some new recommendations that I think you're going to like. One of the things they're saying is that coffee may actually be good for you, may help protect against such things as cardiovascular disease, type 2 diabetes, and also may help protect against Parkinson's disease. They're saying that anywhere from about 3 to 5 8-ounce servings per day would be just fine. Another recommendation that I think a lot of you are going to like is that they're saying that the cholesterol in our diet may not be that important anymore. So if you enjoy those eggs in the morning, go ahead and have them and feel perfectly fine about that. Now, we are looking at fat in the diet, but it's not so much the amount of fat, but the types of fat. And we're finding that the types of oils, fats from the plant sources may be a bit healthier for you than having a lot of animal types of fats in your diet. Another recommendation they're talking about is with fruit. Enjoy fruits in the whole form whenever you can. Like, say, for example, a whole apple will have more fiber than some apple juice. And that fiber is going to help protect against heart disease and cancer, and may help you in controlling your weight. One of the new things that they've been more specific about this time is the amount of sugar that you eat. They're saying you shouldn't have more than about 10% of your calories from sugar. If you're eating the average 2,000 calorie diet, this means about 200 calories from sugar, or the amount of calories in 1 can of soda. And as always, have your food in balance, variety, and moderation, and do choose foods that you enjoy.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.